to understand the question itself, again, we have to understand the personality disorder itself. That certain characteristic in our personality is very pronounced, and it starts to affect our functioning, our relationship, and how we relate to the world itself. So when there is a lot of disturbance between how we are and what we do, then it becomes a personality disorder. Independent personality disorder is one of the commonest type of personality disorder. It's one of the commonest diagnoses, and it belongs to a group of anxious personality disorder, wherein there is prominent feelings of helplessness, submissiveness, and the need to be taken care of. The person requires a constant reassurance, and they find themselves inability to make even day-to-day trivial decisions. And the trivial decisions might be as much as, what do I wear? How do I go out? What do I need to say if I do go out? What if somebody comes home and rings a bell, and how do I open the door? So they become so dependent on the other person that they're not able to function themselves. Understandably, there's a very significant element of underlying anxiety. And because of the other partner giving into the anxiety of this person with dependent personality disorder, they become even more dependent, submissive, and helpless. So any attempts to change the status quo or make them more independent will lead to problems, which lead to behavioral manifestations, and will lead to sabotage. So if you make a little plan to say that, can you come and meet me there alone? And the person will say, I can't, because I've never done this before. So inability to make decisions, avoidance of adult responsibilities, intense fear of abandonment, and a sense of devastation, or when left alone, they become very, very anxious and oversensitive to criticism. They experience an inner sense of pessimism and lack of self-confidence, and they are heavily reliant on the other person, which becomes a counterproductive problem. And as I mentioned, is one of the most frequently diagnosed personality disorder because of the elements of anxiety and the tendency for this personality disorder to cause anxiety disorder and depressive illness. So they require specialized intervention, again, both in terms of using necessary anti-anxiety and antidepressive medicines to help the person reduce the intensity of anxiety and depressive symptoms that may have, but it also requires specialized psychotherapeutic intervention or psychotherapy with the goal of having to make the person more active, to make them more independent, and help them to form healthy relationships. And as I mentioned earlier, some of those attributes can be learned in the therapy itself, where the patient comes and forms healthy relationship with the therapist or the psychiatrist, and consequently they go and apply those formation of healthy relationship outside the therapy setting. So seeing somebody on a regular basis itself will calm them down. You can address their anxieties, you can address their inner inadequacies, and you can address that they are indeed might be more capable than they think they are, and they are not that helpless and useless, which becomes very established in their minds. So dependent personality disorder is common. It's problematic condition, but it can be addressed, it can be treated, and those seeking help will certainly come out feeling much better and feeling more in control and feeling more able to relate to others. And one of the part of the question that you asked me is that how do you deal with the feelings of insecurity associated with this disorder? And as I mentioned earlier, the person feels completely inadequate about doing anything on their own, and they're heavily reliant on other person. So asking them to seek help, to seek therapy, to take medicines can be a big ask for some people. So you need to be non-confrontational, but you need to be motivating and encouraging to say that this is a problem and this needs to be spoken to by an objective, independent person outside of that relationship, outside of that family, so that somebody else can understand that how heavily reliant you have become, gently confront you and start to say that maybe it's time to address some of your anxieties about your fears of being abandoned, about your fears of being alone and separated, about your fears of being left alone and inability to do anything at all. So those needs to be done by an independent, objective, trained professional who is trained to listen, who's trained to guide, and who's trained to steer your thought processes and your worries in the direction that will help you to resolve some of your problems. As a partner on whom the person has become reliant needs to take that role of encouragement and to seek help from somebody who understands it better. So often people understand that going to a psychiatrist or psychologist or therapist would mean that I'm becoming mad, or people think that I'm mad. But you need to encourage and educate people to say that this is not the case. This is to help you to do things better. This is to make you more independent, and this is to make you more able to be on your own when none of us are around forever. Life is impermanent, so we need to learn to become independent sooner rather than later.